All right, everybody, welcome into chapter 8 today. We're going to talk about the basics of bleeding. The average size adult has about 5 to 6 quarts or 5 to 6 liters of blood. And rapid blood loss, like we've talked about in the shock chapter, can lead to shock and death. It only takes about 1 liter of blood loss in an adult before death can occur. Now, 1 liter is not a ton, but in certain circumstances, that can be enough to lead to death. And in a child, it only takes about half a quart or half a liter to lead to death. So hemorrhaging, the definition of hemorrhaging is actually a loss of a large quantity of blood in a short amount of time. So bleeding out very, very quickly is what the definition of hemorrhaging is. Okay, and that is very dangerous. So losing blood quickly can cause a lot of damage and a lot of problems. So make sure you understand that it only takes 1 liter or 1 quart of blood loss before someone can start to go into shock and death. All right. So there are different types of bleeding. So depending on what type of blood vessel is damaged can really determine how we treat that bleeding. So the first type is arterial bleeding, so coming from arteries. Arteries, as we know, are large, they're muscular, and they carry a lot of pressure because it's blood leaving the heart. So arterial blood is going to be bright red because it has oxygen in it, and it will be spurting from the vessel like this picture because of all the pressure. Blood that is coming from veins, right, is going to be more of a flow, so it's going to come out, still going to be somewhat fast depending on the size of the vessel, but it's going to be a darker red, even a purple color of blood. That's because of the lack of oxygen. And then capillary blood, so from those little tiny capillaries where oxygen and nutrient exchange occurs, that type of bleeding is more of an oozing. So as you'll see from this first picture, it comes out much slower, and color is more of a mix between the bright red or the darker red. Okay. Make sure you understand those. That's a quiz question. All right, so the body does naturally respond to bleeding. So once your brain senses that you're bleeding somewhere, there will be a natural blood vessel spasm that causes those blood vessels to draw back and constrict to try and prevent some of that blood loss. But you can't prevent all of it with that. The other thing our body does naturally to help slow down bleeding is clotting. So platelets, the cells in our blood called platelets, those, when they are triggered by the body, clump together, and those are what forms the blood clot. Okay, and afterwards, the blood clot will serve as a protective covering for the wound. It turns into a scab and those sorts of things. All right, so now we're going to talk about dressings. So dressings are the materials that we put directly on top of a wound, especially an open wound. Okay, make sure you understand what the word hemostatic means. So hemostatic, when I talked about medical terminology, hemo means blood, and static means stopping or motionless. So a hemostatic agent is something that stops bleeding. Okay, it's an agent that stimulates those platelets to clot up even more, causing the bleeding to stop. So we do have types of dressings that you can purchase, like this combat gauze that has hemostatic agent in it to help stop bleeding. Okay. Make sure you also understand the difference between a dressing and a bandage. The dressing directly touches an open wound, whereas a bandage covers a dressing and helps hold a dressing in place. So band-aids are kind of like cheating because it has a bandage and a dressing in one. The dressing is the little white square that goes right on top of the open wound, whereas the sticky portion of the band-aid is the bandage, right? Okay, now talking about external bleeding and how we're going to treat that. So there are many different types of injuries that may involve bleeding um, that we may have to care for. There are some that are more serious than others. Some life-threatening examples would be arterial bleeding. So if blood is spurting out of a wound, arterial bleeding is very hard to stop and requires a lot to get it to stop. Blood-soaked clothing, mainly because that shows a lot of bleeding, high volume of bleeding. Anytime there's blood pooling on the ground, that's another sign of very heavy bleeding. An arm or a leg or an extremity that is partially amputated, especially an arm or a leg, like fingers and stuff, that's not as serious, but further up the extremity, that can lead to a lot of bleeding and is definitely life-threatening. So as far as how to care for external bleeding, the first thing you're going to want to do is put on gloves if you have access to them. And then we're going to want to expose the wound so that we can see it. Also, this is a quiz question, so make sure you understand all the parts of this. Again, if you don't have gloves, you can try and improvise with other materials. Use like a plastic bag over your hands or something like that. Exposing the wound is going to help you to find the source so you can better care for it. Once you find the source of bleeding, you want to take a dressing and apply direct pressure. Okay, you want to put a lot of pressure on there. That will help stop the bleeding. If the original dressing that you put on there becomes soaked with blood and it's no longer able to soak it up, don't pull off the blood-soaked dressing. Like it says right here, never, ever, ever, ever remove a blood-soaked dressing. You just take a new fresh dressing and put it on top of the original. Okay. If you pull off a blood-soaked dressing, all of the work that your blood has done to try and clot and try and stop that bleeding is just going to be reversed. Okay. Ice can also be helpful in slowing down bleeding. Ice does a very good job of slowing down blood flow. So if you put ice above the wound, that can help the bleeding to slow down. And then if you need to, you can use a tourniquet, which we're going to talk about a tourniquet here in a minute. I have a quick story. One time, as an athletic trainer, I was covering a wrestling tournament, and this wrestler got a cut right on the bridge of his nose that was bleeding pretty heavily. We were able to cover it, and it was able to last long enough for him to finish the match that he was in. But he had one more wrestling match to wrestle that he wanted to finish before he had to go get stitches. So, in order to accomplish that, we tried a couple of things. First of all, I sat him down, but I kept him sitting up to try and help gravity prevent the blood from flowing upward. That can help slow it down. I put a dressing right on top of it and had him put some direct pressure. But then we took an ice bag and put it on his forehead to help slow down the blood flow to his nose. And we were actually able to get the bleeding stopped. We covered it. He finished his last match, and then he was able to go get stitches after that. So it really does work if you'll use it. Okay. Tourniquets. So a tourniquet may be needed if bleeding doesn't stop with direct pressure. So if direct pressure is not enough, you may need to use a tourniquet. Now, there is a quiz question on this slide, so make sure you understand this information for the quiz. A tourniquet is a special device that basically just puts a lot of pressure around an extremity to stop the blood flow and to cut off blood flow. You can use a manufactured or an improvised tourniquet. Manufactured are just commercial, like branded tourniquets that are specific to be a tourniquet. Whereas an improvised, you can use things like a triangle bandage and a stick to create a tourniquet. So as far as how to apply it, I'll just quickly explain it. To watch the video, you're going to need to go to the modules and watch the video there in the modules. So you're going to apply it 2 inches above the wound, and you can only apply it on an extremity, meaning you can't put it on somebody's trunk, somebody's neck, something like that, because that can cause damage to vital organs. Okay. Um, you're going to keep tightening it until the bleeding stops. Okay. Um, Once the bleeding has stopped, you're going to secure it in place. Most tourniquets have a built-in securing mechanism. Okay. And then you're going to write the time that the tourniquet was put on the person. This is because when EMS shows up and they see that tourniquet, they'll know when it was put on, because the old way of thinking was that once a tourniquet was placed on an extremity, that person was going to lose that extremity. But now we know that's not really the case. You can leave a tourniquet on for, I believe it's about 2 hours before that person is going to lose that limb. So they can take it off. That's why writing the time on is very important. If the bleeding will not stop and you've tightened down that first tourniquet as much as you can use a second tourniquet. That is possible. Okay, again, I'm going to skip this video because you guys won't be able to hear it or see it. So go to the modules to refer to the video for how to put on a tourniquet. All right, now referring to internal bleeding. So you can get internal bleeding. Most of the time, internal bleeding happens from a blunt trauma. So getting hit with something, getting in an accident, but it can happen from other things like illness, those types of things. So the things to look for, anytime there's bright red blood coming from the mouth, the rectum, or somebody has blood in their urine, that's a sign of internal bleeding. Um, any sort of vaginal bleeding that's not during a woman's period, so is not in the right timeline for their cycle. If they vomit blood, any sort of black, foul smelling, or very tarry looking stools is a sign of internal bleeding. Pain, tenderness, bruising, or swelling. Broken ribs, any sort of bruises over the chest, or a rigid abdomen. So, anytime your ribs are broken, the ribs can become a sharp projectile that can cause damage and can cause internal bleeding. So, you do have to watch for that. A rigid abdomen. So if you push on somebody's abdomen and it is rock hard, I mean, I don't care how hard abs you have, it's not going to be this rigid. It's going to be very abnormal. That's a sign of internal bleeding, a very important one. Okay. And then anytime you have some severe bruising in an area, all bruises are really is internal bleeding. Just most of the time it's very minor. But heavy bruising can be a sign of some heavy internal bleeding. Okay. Now that is a quiz question. Make sure you understand that information. As far as caring for internal bleeding, what you're going to do is you're going to monitor the person's breathing. You expect vomiting, so make sure if they're conscious that you have them in the recovery position or in a position to where they can get rid of that vomit without choking on it. Then you're going to treat the person for shock. If it's severe internal bleeding, you will have called 911 by now, right? If there's internal bleeding in an extremity, you can apply a splint and or a tourniquet if necessary, and then you want to seek immediate medical care. Bruises. So like I mentioned, bruising, all it really is internal bleeding. They're usually not very serious. The biggest thing you're going to want to do is you're going to want to put ice or something to slow down. We're going to attempt to slow down the blood flow to that area. So applying some ice to slow down that blood flow, or also use elevation of that extremity, if it's on an extremity especially, to help gravity prevent the blood from flowing to that area. Okay. If it's on an extremity, some other things you can do, you can apply a compression bandage to help prevent the blood from settling. You can also place several layers of gauze pads or cloth between the bandage and the injury. This helps put a little bit of extra pressure on that. The big thing with bruises is you do not want to let the blood settle for too long. So sometimes if you get a lot of heavy bleeding with a bruise and the blood settles, you need to apply some pressure and massage that to push the blood out of the area. If the blood sits for too long, it can lead to a condition that's called, and this is not part of a quiz question, this is just for your information, can be helpful. It can lead to what's called osteochondritis dissecans, which is where the blood hardens and calcifies and can actually cause damage to soft tissue like muscles, tendons, ligaments, those types of things. So you got to be careful with that. Bruises that start to get really hard can lead to hematomas when the blood hardens, and then when it calcifies, it becomes osteochondritis dissecans. So make sure you watch out for that. That's bleeding. If you guys have any questions, again, please feel free to reach out. I'm happy to answer any of your questions. Thanks.